Hey everybody, it's Kelly again. Today I want to talk about schizophrenia. This is one of the more fascinating mental health diagnoses, at least to me. It's one that I really became fascinated with back in my undergrad, and it's just the way it manifests in people is very different. I've not seen any two people who have been diagnosed with schizophrenia with the exact same symptoms. But anyway, I digress a little bit here. Schizophrenia, it's a long-term mental health condition that affects how a person thinks, feels, and behaves. It impacts about 1% of people worldwide, and it makes daily life very challenging for them. The different types of schizophrenia and the symptoms and what it happens if it's not treated is what we're going to get into here. So paranoid schizophrenia is one particular type. People who have paranoid schizophrenia, they have very strong beliefs that others are trying to harm them. Whether that's true or not, to them, it is very true. It is very real. And they may hear or see things that are not there as well. So they have visual and auditory hallucinations associated with this. Another type is called disorganized schizophrenia. This one is very challenging for a person to live with. It makes it very hard for them to think clearly and to communicate their needs. A person may speak in a very confusing way, and they will struggle with daily tasks like dressing appropriately. It's just not, their brain is not able to get them to do tasks in an easy manner. It is very jumbled for them. Catatonic schizophrenia. Some people with catatonic features and catatonic schizophrenia become very still and unresponsive. Or they will have very, very limited, very slow movements. Some people, on the very flip side of this, may have excessive movements that have no purpose, and they may repeat the same movements over and over again. Undifferentiated schizophrenia. This term is used when a person has symptoms that do not fit clearly into just one category, but they still have signs and symptoms of schizophrenia. And then residual schizophrenia. A person may not have strong delusions or hallucinations with this diagnosis, but they will still struggle with a lack of motivation and avoiding social interactions. So if left untreated, what can happen? Memory and thinking problems becomes harder and harder to focus, to solve problems, and remember things. They may be more isolated, and because people may avoid them because they don't understand how to socialize, and they feel confused, scared, misunderstood. They will have difficulty working and living independently. Without treatment, maintaining a job and daily responsibilities can become extremely difficult. And they have an increased risk of harm. Some people with untreated schizophrenia are more likely to harm themselves or feel hopeless. There are several treatment options for schizophrenia. And with the right combination of medication, therapy, and support, it is treatable. So the medications are antipsychotics. And antipsychotic medications are grouped into two basic categories. The older, more typical antipsychotics, and then you've got the newer. So we got a first generation and second generation. And it's not that the older ones are bad, they're just older because they were invented a long time ago, and the newer ones were invented more recently and have fewer side effects. Some of the older medications include Haldol and Thorazine. They help with hallucinations, but may have more significant side effects like muscle stiffness. Some of the newer antipsychotics are Risperdal, Clozaril, and Zyprexa. And these work well and have fewer muscle movement related side effects. So counseling and therapy, the cognitive behavioral therapy, can help a person manage the thoughts and emotions that they're having. help them to recognize when they're having hallucinations, recognize that that voice that they're hearing is not really there, or that person that they're seeing is not really there. Family support programs, which is, I think, one of the more crucial pieces in treatment of schizophrenia, is to give the support to their family and caregivers who are going to be having to help them after they, return to their home setting. This educates the family members on how to cope with their loved one's diagnosis, as well as how to help their loved one be successful in treatment. And then there are social skills training, teaching them everyday skills, how to improve communication and relationships. Then for the community, they have community services, sometimes called ACT teams, around where I work and live. This is a group of individuals that is connected with the patient, and they check in with them periodically, make sure they're doing well, making sure they're getting the services they need, they're getting to appointments, those kinds of things. And there's also job skills programs and training programs to help them become a functioning member in their community. With proper treatment, all the things that I just discussed, someone with schizophrenia can lead a meaningful and productive life. Medication, therapy to reduce symptoms, and helping build into their relationships with and be able to work is going to be key. And making sure that they maintain their medication regimen. Staying on the medication is one of the most key important things to being successful in treatment of schizophrenia. So, and if you want to learn more about the antipsychotic medications, look for my video, and see you next time.